It is now time for Ask the Expert. Tomorrow is World Hepatitis Day.
So joining us live this afternoon to talk about the disease is Dr. Ajay Sahajpal from Aurora Health Care. So let's start with the basics. What are the symptoms of hepatitis?
So hepatitis is essentially inflammation of the liver. Just like if you bump your knee and your knee gets swollen, it's the same process to your liver. World Hepatitis Day is really to recognize viral hepatitis. So the acute symptoms are flu-like symptoms, actually. So, very rarely people can get acute liver failure and need an urgent transplant or die. But typically it's flu-like illness that lasts for a few weeks. And the symptoms are really feeling like run down, fevers, chills. But then there's a chronic form of that that can progress to silent liver disease and then ultimately cirrhosis or liver cancer.
So there's different types of hepatitis. I do know that. So can you talk about how those different types spread?
Yeah. Doctors tend to be very simple-minded. So hepatitis A, B, and C are the most common. So we just use the alphabet. But hepatitis A is usually actually food-related. So what we call fecal-oral transmission, or people not washing their hands after using the bathroom.
So you could get that from like a restaurant?
A restaurant, daycares, for example. Hepatitis B is fluid-borne, blood-borne, sex-related, sexually transmitted, and Hep C is really tied to baby boomers and blood transfusions.
And is Hep C something we can get a screening for?
Yes, actually. So we started a screening process in 2014 when new medications hit the market that were very effective. Really screening baby boomers because they were highest risk. It's very effective in terms of treatment now, so it's very easy to screen for.
Awesome.
Dr. Ajay, thank you very much for coming in and talking about this important topic. If you have a question for our experts, email them at asktheexpert@today'stmj4.com. You can also leave a voicemail. The number is right there for you.